I got the bug for cancer patient advocacy while I was still a patient in treatment. Because one of the things that I discovered, to my total horror, was that the best practice chemotherapy for my kind of cancer wasn't available in my province. It was available everywhere else, in every other province, and in the United States and Europe and Australia, everywhere, but just not here in Nova Scotia. And so I and my community lobbied the government, successfully lobbied the government to extend our formulary to include the best practice chemotherapy, FOLFOX chemotherapy, but unfortunately too late for me to receive it. So that is one of the stories you hear when you, in this book, the Cancer Olympics, where I've described what that was like, what that fight was like. But there is another more painful reason why I chose to become an advocate, more difficult to talk about, but even more deeply and passionately attached to advocacy for this reason. And that's also a topic that's raised in the book here. And the reason is that I received truly terrible diagnostic care. So truly terrible. It's not just my opinion. It was so truly terrible that 3 of the 4 doctors I saw on my diagnostic pathway were disciplined by the College of Physicians and Surgeons for their egregious cancer negligence. So an endoscopy that should be 60 days by our new practice standards in our province, in my case, took 661 days. So from when I first walked into a family doctor's office with semi-urgent symptoms of colorectal cancer to the day that I got treatment for a T4N2 stage 3C colorectal cancer was 2 years to the day. So because of that, I left that experience saying, I don't want any other Nova Scotian, I don't want any other human to undergo that kind of medicine, that kind of experience. So when I learned that in my province, my province was going to have a cancer standards oversight committee that a patient can join, I was all over that. I joined that. I met many people who had very similar stories, sad to say, but who were equally committed to improving standards of cancer care, standards relating to treatment. But in my case, fundamentally, passionately, I wanted to assist my province in developing standards of relating to detection and diagnosis of colorectal cancer, because the best treatment standards in the world don't matter if people are being detected too late to save them. So what that means, in Nova Ontario had done something kind of similar. What we did in Nova Scotia is we took what Ontario had done, and they'd worked out what sort of symptoms should a family physician refer someone to an endoscopist urgently, as in within 4 weeks, this set of symptoms, and what are the set of symptoms for which someone should be referred urgently within 8 weeks. So 4 weeks, 8 weeks, not 661 days. And in our case here in Nova Scotia, what we, the patients, did was we pushed and pushed and pushed the healthcare providers to say, this can't be just left up to by guess and by golly. This has to be a systematic, methodical process. So we, along with GI specialists and surgeons and other experts, designed a template, a checklist, if you will, that family doctors must go through in order to refer someone to endoscopy. That does include things like family history, things like the nature of the rectal bleeding if present, the nature of the anemia if present, all of this kinds of signs that ought to be alarm symptoms to a family doctor and cause prompt diagnosis. So what I can say about being an advocate, I can say that it was such a privilege to assist my province in a systemic response to the kind of mediocrity that underlay my horrible but avoidable outcome. And that in my province of Nova Scotia, there are about 1,000 colorectal cancer patients diagnosed each year. So that's 3 every day. And we're a little tiny province. We're not even 1 million people. So if there's better standards of diagnosis and detection, that saves hundreds and hundreds of lives. And so, you know, I don't know I don't have the greatest prognosis as a result of my late state at which I was detected, but I'm determined to dedicate the rest of my life to making sure that no one else dies prematurely.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.